Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. And I'm happy to announce that, at least from what I can tell from my side, my microphone is working tonight. And obviously, if I'm showing up here, I was able to get to the webinar program to connect to the internet tonight, too. So many of you may know I've actually had some difficulties here the last the last 2 weeks actually being able to pull off one of these webinars to make it happen. But I think we've gotten through all the technical difficulties, and I want to thank you all for bearing with me about that too. Also, last week when I did send out an email telling everyone I had another round of technical difficulties, a number of you wrote back in support, and I appreciate the kind words and nice comments that many of you gave as well too. So the way these webinars work, if you're new here, let me explain it. For those of you that have been here before, I know you know how this functions, but you get to create the webinars with your questions. And the way you do that is you write them to me. And you can write them to me over here on the bottom side, right down there at the bottom, on the right-hand side of the screen is a chat box. As you write your question, I will see it on my side. You're not going to see the questions that everyone else is writing on your side, okay? I think you still see your question, though. I try to get through as many questions as I possibly can. As I read a question, I will post it for you to see. Those of you that are live in the webinar tonight will actually be able to see it as I post it, okay? Those of you that are watching a recorded version will not be able to see those questions. They don't show up in the recording, actually, all right? And so far, I'm not getting any complaints here from anyone. That looks like this is working. That's good. Anyhow, tomorrow morning, you all will get a recording or an email from me saying that a recorded version of the webinar is available. I usually try to get that out somewhere around 6 to 6:30 in the morning Seattle time. So watch for that email to come out. And it will give you notice that the recording is available. If you happen to not get that email for some reason, you can take a look at treatlyme.net, which is my Lyme disease information site. Go to the webinars page, and from there you can click on the webinars recording link, and you'll be able to get access to the recorded version of this, okay? To those of you that are returning, welcome back. And I'm always glad to see a number of new faces here as well, too. As you're entering or writing your question, I just remind everyone, please only hit enter when you have completed your question. If you try to hit enter to create paragraphs as you're writing your question, it actually creates multiple questions from my side, which get to be a little bit difficult to manage, okay? All right, so with no further ado, I think we are ready to get started here. All right, so this is the first question. Let's see. Hello, Dr. Ross. So grateful for your help. You're welcome. I heard Xifaxan, which is also called Rifaximin, is great for intestinal Lyme. Have you had any success with it? I'm having tingling neurosymptoms in my gut after I eat. Any suggestions? So I have never used a Rifaximin, which is also called Xifaxan for Lyme, because it's actually manufactured to treat something called small intestinal bowel overgrowth, all right, which is basically you get bacteria in the small intestines that work their way into the small intestines that are actually supposed to be in the large intestines. And they work their way through an opening where the small intestines and large intestines connect together around your appendix, actually, called the ileocecal valve, all right? So Xifaxan is useful for killing those kind of bacteria. It stays in the intestines. It's actually not systemically absorbed. It's not absorbed into your bloodstream at all, and therefore would not be a useful treatment for Lyme, systemic Lyme. And I have not seen it actually used to treat Lyme in the intestines, all right? So I haven't seen it used that way. If you are aware of people reporting some benefit, it's probably because it's treating their small intestinal bowel overgrowth, all right? Let's see. And then you have a second part of your question. See, I'm having tingling neurosymptoms in my gut after I eat. Any suggestions? Actually, just with that brief explanation, no, I'm not quite sure what that means. I would need to ask you a bunch of other questions about your health to be able to figure out what that actually means. All right. So obviously in this forum, I'm not able to do that. The one thing I will show you, and this is for anyone that's attending the webinars tonight as well too, I'm going to go ahead and do a quick screen share here. I want to just show you one thing you can take a look at later. All right, so this is at treatlyme.net, which is my Lyme disease information site. There is a tab up here on the top called Online Consult. If you tap on that, that pulls you to a page that gives you information about how to visit with me over the internet, doing a Skype visit. And that's where I can give you further advice and even give you information or learn more about your illness so that I can help you, okay? Now, I will tell you about these one-to-one online consults. They, because I cannot examine you in them, I cannot write prescriptions for you or order tests, but I can give you lots of information. And I would read all the way through so you understand how it works. There's even a disclaimer form that I have that you should read through too. But basically, I can give lots of good information in an online consult. I can tell you what I'm thinking. If you happen to need prescriptions to be written, often you can find a physician that will write those prescriptions for you. And many of the recommendations I have are more about herbal options that you can use for your illness as well too. Okay, so Brenda, you may want to take a look at that. All right. If you are interested in doing it, I would just ask, read the whole page before you contact my receptionist. Many of the questions you might have that you would ask her, you can actually read on that page. Okay. All right. Thank you for that question, Brenda, and good luck to you. All right. Let's see here. Okay. So the next question I just want to let everyone know is it looks like there's a person, Yara, who actually wrote a question to me here, has a long question. So I'm going to show it, display it to you in different parts. So I think there's about 5 parts to this, okay? So hello, Yara. Hi, Dr. Marty. I was diagnosed and treated for chronic Lyme in 2010 with 6 weeks of 1 antibiotic. Some symptoms went away and others lingered and lessened over the following 6 to 12 months. Fast forward to 2016, I started to have symptoms reminiscent of Lyme and co-infections. And these included, let's see here, neurologic issues, face tingling, air hunger, chronic fatigue, chest pains, anxiety, memory and cognitive issues, and had been having gastro issues, including painful chronic gas for 2 years. Wasn't really thinking Lyme at first, except for the face tingling. Found a naturopathic LLMD, and the test results are below. Does this sound like a resurgence of the Lyme to you? Nowhere near as bad off as I was in 2008 to 2010. My LLMD is sure that it's all coming from Lyme and thinks it's also Babesia and Bartonella and wants me to do 3 to 4 antibiotics for 6 to 12 months. Let's see here. I really don't want to go that route. What are your thoughts about the results below? Thank you so much for your time. Okay, so Lyme testing, the Western blot for an IgG is positive at 4139. Okay, so your IgG Western blot is positive for Lyme. You're having antibodies against protein 41 and protein 39. Those are proteins found on the covering of the Lyme germ, is a positive Lyme test, okay? Now, the problem is once you develop a positive Lyme test, you're always going to keep a positive Lyme test. So getting Lyme testing at this point is not going to tell you whether you actually have active Lyme or not active Lyme, okay? This just says that your body has made antibodies against the Lyme germ, but that could even be from your original infection, all right? So that doesn't give me a clue as to whether you have active Lyme. In fact, there is not a test you can do that says your Lyme has gotten active once you've had positive Lyme testing in the past, okay? I just want you to know that. All right, your Bartonella testing was negative, and your Babesia IgM was barely positive at 1 to 20. Let's see here. Some other results, VEGF 31. I'm not going to read every one of these. Okay, here's my thoughts for you, Yara. I'm going to go back to where you wrote the first question that you gave, which was about what your symptoms are doing, or the second part. All right, so your symptoms are tingling, air hunger, chronic fatigue, chest spasms, anxiety, memory, and cognitive issues. Okay, so your symptoms that you're describing here, okay, are consistent with possibly having Lyme and are consistent with possibly having Bartonella. I don't see this as being consistent with Babesia from a symptom standpoint. I suspect your Lyme literate medical doctor is thinking of treating Babesia though because your IgM antibodies, a family of antibodies that your immune system makes against Babesia, was not negative, but it was almost negative, okay? That level of 1 to 20 basically looks at how many times do you have to dilute the blood before you don't see any antibodies that could be against Babesia. We consider it to be normal if it's less than 1 to 20, and it's positive if it's 1 to 20 or higher, but that's kind of gray. That result is a little bit gray, all right? From the symptoms you just gave me here, I'm not really seeing symptoms of Babesia, except the air hunger can be Babesia, but Bartonella can also give you air hunger. Bartonella can give you anxiety. Bartonella can give you the memory and cognitive issues, and so can Lyme too, unfortunately. All right. So, but there's one thing I want you to do before you even start treating. So in my experience, when somebody has what looks like a Lyme disease and even a co-infection relapse, about 80 to 90% of the time, it's actually due to the fact that you've developed too many yeast in your intestines. Right. Now that may seem kind of far-fetched, but just hear me out on this, all right? So that's 80 to 90% of the time that somebody looks like they're having a relapse. It's actually too many yeast in the intestines. And here's why, all right? So when you have Lyme disease, the reason you feel sick, the reason you get symptoms is that your immune system, in trying to get rid of the germ, makes a group of chemicals called cytokines. Now, I know if many of you have been to my webinars or if you've read any of my stuff in the Treat Lyme book, you know I talk about cytokines, okay? It's like the central thing about what Lyme disease is. What Lyme disease is a syndrome of too many cytokines, all right? So white blood cells, when they see Lyme germs and they see Bartonella or they see yeast, try to get rid of them, and they manufacture these chemicals called cytokines. Now, cytokines are good, and in excess, they're bad, all right? On the good side, they cause more white blood cells to be made. They draw those white blood cells to where the infection is, and they help those white blood cells work better. That's great. That's the good stuff. That's what you want it to do. However, in yeast overgrowth sometimes in the intestines and sometimes with Lyme, the immune system doesn't do a good job, and it keeps trying harder and harder, and eventually their immune systems make too many cytokines. What your Lyme disease symptoms are actually too many cytokine symptoms, okay? So too many cytokines can give you the brain fog and the difficulty thinking, can give you body pain, can give you fatigue, can give you basically all those symptoms we call Lyme symptoms are actually too many cytokine symptoms, okay? Now, if you, from having been on antibiotics in the past, there is a risk you have that being on the antibiotics upset the normal balance of good bacteria and yeast in your intestines, allowing the yeast to gradually grow too much and take over too much territory from your good bacteria. And when you get too many yeast in the intestines, guess what they do? They trigger cytokines, all right? In addition, they release a toxin called gliotoxin that gets absorbed into your bloodstream, goes to the brain, and gives you a lot of that cognitive dysfunction. And the gliotoxin can even give you some of the neurologic dysfunction as well, too, all right? So it's possible when people get relapses that it actually isn't a relapse of the Lyme or the co-infections, but rather it's all yeast. So how do you know if it's yeast? Well, sometimes it's not always clear, but here's the things to look for. So look to see, have you had any increased sugar cravings? Okay, that's one thing. Secondly, are you having any problems with intestinal gasiness or bloating? Third thing is, have you had any recent problems with vaginal itching or vaginal discharge? If you're female, okay. And then also sometimes people with yeast problems will have difficulty swallowing because those yeast start to grow up in the food pipe, and then they have a hard time getting things down. Sometimes you'll have obvious white sores in your mouth that can indicate yeast. You'll have rawness. But the other clue of yeast is an interesting one, and that is sometimes people with intestinal yeast overgrowth will also get increased problems of acne or pimples or skin rashes. And that probably has something to do with the toxin that gets absorbed out of the intestines interacting with the skin, leading to these problems, okay? So the first thing I always do is I look to see, is there yeast based on those symptoms? Testing is not useful, okay? Some of the naturopaths like to do yeast testing, or either looking at antibodies to see if you have them or looking to see if you'll grow yeast in the intestines. They're not accurate. You got to look at what are the risk factors and what do the symptoms tell you, all right? And Yara, if you really want more input, I could give you more information about what I'm thinking here. You might want to consider one of those one-to-one consults, but it is, from what you've written here, look at yeast. And if it looks like it is not yeast, then the next steps would be to consider treating for Bartonella and Lyme based on your symptoms. I'm not clear what that IgM that you had for the Babesia, I don't know. I don't know if that really means you have active Babesia. What you can do is look at my article on how to diagnose Babesia. Basically, if you have enough symptoms of Babesia, I probably would treat, but just air hunger alone does not mean Babesia, okay? So I'm going to show you a few resources to take a look at here. I'm going to do a quick screen share to do that. All right, bear with me as I get there. Okay, so in the Treat Lyme book, take a look at the chapters tab, all right? The first thing I want you to look at is the article that I have on yeast, a silent problem, do you have yeast? Okay, read through that. You'll see why I'm wondering about yeast, okay? If you do have yeast and you're wondering what's a good way to treat yeast, I have multiple options in my article called Kills Yeast, a Brief Guide. Okay, so start there, all right? Second thing I want to show you is the how to diagnose Babesia. So take a look at the chapters on this How to Diagnose tab, all right? And I have an article about how to diagnose Babesia. It's right here. I don't usually rely on tests, actually. I usually look at what the symptoms tell me, okay? All right, and then finally, if you really want a lot more of my input, take a look at my online consult. I'd be glad to help visit with you to see if I can get a clearer picture based on what your symptoms tell me, okay? All right, let me go back here. All right, so everyone, I want to make a point here. One of the things I always say is when you get a decline, either what looks like a relapse, or if you're in treatment, you're doing great, and suddenly things go down, I always look for yeast first. It is such a significant factor in what happens with people and can be a great explanation for decline, okay? Even if you're doing great yeast preventive work as well, too. All right. Yara, thank you for that question. And I hope everyone, I know that was long-winded, my response to her. But I hope you all got something out of it. The other thing I just want to repoint out, there is no test that says Lyme got active. All right. I know some of my colleagues go back and redo the Western blot, but you know, when Lyme goes into remission, if you've had Lyme in you for a year or more and you get it in remission, we probably are not knocking it out. It's probably still in you. So your immune system is always going to make antibodies. And there's been studies that look at the Western blot antibodies. They will come and go during treatment, and even at the end of treatment, they come and go. But just the fact that they're there, we would expect them to be there because we never knock the germ all the way out, okay? So I know some of my colleagues do these Western blot tests to figure out if Lyme is active. I think they're wasting money. And I don't think they really get it that you're going to keep making positive Western blots, all right? Some of my colleagues also will go back and do a test called a CD57. A CD57 is a type of white blood cell that will be low when Lyme is active. But it, in some people, and so it's low about 80% of the time when Lyme is active. What I find, though, is that for a lot of people, even when we're done treating them, it never goes into normal range. So having a low CD57 does not prove that your Lyme has gotten active either, okay? And there's a whole article I have on CD57. I'm not a big supporter of CD57s, but you can take a look at that later. It's in the testing part of the Treat Lyme book, all right? All right. Let me go ahead. So everyone, I got to go through Yara's questions and remove them from my board here. So just bear with me a minute as I'm doing that. Yara, good luck to you too. And thank you for that question. All right. Hello, Jacqueline. Let's see. I am being treated for Lyme and Babesia as well. I have chronic mycoplasma pneumoniae and extreme bilateral trigeminal neuralgia. Could these have caused my trigeminal neuralgia? Okay. So I think what you're asking is, could Lyme, Babesia, or chronic mycoplasma pneumoniae give you the trigeminal neuralgia? So everyone, trigeminal neuralgia means there's a nerve up here called the trigeminal nerve, and it can get inflamed and it can hurt, and it can be a really painful kind of condition. Neuralgia means nerve pain, okay? Anything that has the word in medicine, algia, that means pain and inflammation, basically, all right? So what could give you the neuralgia? Well, Lyme can give inflammation of nerves, so that's possible. I wouldn't think of Babesia usually as inflaming nerves, all right? Bartonella, I think of sometimes inflaming nerves. And so I would need to ask you a lot more questions to help figure out if Bartonella is part of this. And as many of you know from these webinars, I usually think that you make a Bartonella diagnosis based on the symptoms as well. And the reason I do that is the testing isn't perfect. For Bartonella, we have 30 strains. We can only do decent testing about 2. So I'll look at what the symptoms tell me on that. So if you want to know how to diagnose Bartonella, there is an article I have on that in the Treat Lyme book and the How to Diagnose chapter. Take a look at it, read it. It tells you what symptoms you should have a lot of to figure out if you have Bartonella, okay? All right. Chronic mycoplasma pneumoniae, I think, is given too much attention. Let me put it that way. And here's why. So both mycoplasma pneumoniae, which is a bacteria that lives in your cells, and another bacteria called Chlamydia pneumoniae, which is not a sexually transmitted chlamydia. There's a form of chlamydia that is sexually transmitted. This is not the sexually transmitted form, all right? But Chlamydia pneumoniae and Mycoplasma pneumoniae are 2 very common bacteria that actually exist in healthy people. In fact, if you were to poll 100 healthy people off the street and we were to do laboratory testing of those healthy people, we would find about 10 to 20% that have elevated antibodies in their blood against mycoplasma and chlamydia. And so just having elevated antibodies does not mean the germ is causing you a problem. All right. In addition, many of the antibiotics that we use to treat Lyme will treat these anyhow. So any of the antibiotics that we use to treat intracellular Lyme that lives inside of your cells, which would be the macrolides of Biaxin and Zithromax and the tetracyclines of Doxycycline, tetracycline, minocycline, any of those intracellular antibiotics will also treat mycoplasma and chlamydia. And probably rifampin, which is something I use for cyst Lyme and I use for Bartonella, will also treat those as well too, okay? But I am not a person that's a big believer in going after chronic mycoplasma pneumoniae. I think it's background noise. In other words, it exists in even healthy people. I don't think that is what the problem actually is. Now, I know there are some of my colleagues that disagree, and I would like them to show me the evidence that says that it actually is a problem, because I haven't seen it, okay? So anyhow, Jacqueline, I hope that gives you some information to think of. I would look at Lyme, and I would go back and reconsider, could this be Bartonella? Could you have Bartonella as part of your problem, all right? And let me just show you one thing that you should take a look at here. I'm going to do a screen share. Actually, I'll show you a couple things. All right, so we're going back to the Treat Lyme book. All right, so in the chapter called How to Diagnose, right there, over in my tab called Lyme Disease 101, How to Diagnose, you'll find an article called It Could Be Bartonella or Babesia, the Symptoms and Signs. Read that, okay? That will tell you about what makes you, or what is the possibility that this could be basically Bartonella, okay? The other thing I would look at, so when you have nerve pain, you have to heal the nerve. And so you need to start doing some supplements that can help heal the nerve. And to do that, let me show you where you would look. You want to look in the chapter called Brain and Nerves. All right. And take a look at this article called Neuropathy Repair, Heal That Tingling, Numbness, and Pain. And I give you a variety of steps that you ought to look at to start treating your nerve injury that you have going on here as well too. All right. Okay. So let me go back here. All right. Good luck to you, Jacqueline. And thank you very much for that question too. Hello, Linda. Let's see. Well, it looks like there is supposed to be a first part to your question. And it didn't show up. Well, here's a problem. Linda, I don't have your full question. I can't answer it. I've only got the second part here, so I'm going to have to let that go. All right. If you are looking for my ideas on how you treat Lyme or Bartonella, I have two articles about antibiotics for Lyme and antibiotics for Bartonella. One is called one of them is free, actually. Let me show you. Okay, so this would be in the Treat Lyme book. Okay, so in the free reads chapter, right here, this free reads tab, take a look at the Lyme disease antibiotic guide, okay? All right, that'll get you in the ballpark in terms of different things you can do for Lyme, all right? And then look under chapters under infection treatment plans for ideas on how you can treat Bartonella, and take a look at this article called Kills Bartonella, A Brief Guide, where I outline various antibiotics and antibiotic approaches to treating Bartonella too, all right? Now, one thing I want to say there, if I've got somebody that has Lyme and Bartonella, often I like to use a combination of Rifaximin, which is one of the best BART antibiotics we have. And it can also treat cyst Lyme and may help with intracellular Lyme, okay? And I like to combine that either with a tetracycline or a macrolide. Again, macrolides are Biaxin or Zithromax, all right? Those two antibiotics make a good Bartonella treatment. And in addition, when you combine a tetracycline or a macrolide along with Rifaximin, you now have a regimen that treats all three forms of your Lyme germ, okay? And again, everyone, remember, Lyme exists in three forms in you. It lives as a spirochete, which looks like a corkscrew. You've seen those pictures on the internet. It lives inside the cells as intracellular Lyme. And then there's a form, which is a microscopic cyst form of the germ. You have to treat all three forms. But a combination of Rifaximin, either with doxycycline, minocycline, Biaxin, or Zithromax, is a regimen you can use that will treat all three forms of Lyme germ and actually treat Bartonella really well too. Okay, but you can read more about it in those articles. All right. All right, let's see here. Let's move on. Good luck to you, Linda. Hello, Victoria. Let's see. Hi, Dr. Ross. Do you think taking low-plex SR iodine with hypothyroid meds is a good idea? My pharmacist suggests this. Also, are frequent sore throats part of Lyme, and if so, why? Thank you. All right, so I don't like using iodine. And here's why I don't like using iodine. There isn't a good way to see if you're getting too much. And if you actually get too much iodine, it actually can suppress your thyroid function, all right? So it actually messes up your thyroid. And so for that reason, I tend not to use it, okay? So I don't use that product, nor am I a supporter of using iodine when somebody has low thyroid, okay? Let's see. Also, so frequent sore throats, yep, that can happen in Lyme. Also, if I've got someone getting frequent sore throats, you tend to see that sometimes in Bartonella as well too, okay? All right. Good luck to you, Victoria. Hello, Colleen. Let's see. Hi, Dr. Ross. I've got an active Lyme infection and possibly Bartonella, possibly infected vagus nerve, and my body may have difficulty detoxing. Would a massage be a good idea for me? And if so, what kind? Thank you. Ooh. So, just based on that, okay, I mean, obviously you may have a lot more going on than what you're able to put in that brief paragraph there. You've got to be careful with massage, especially deep massage. I see that people with Lyme, and especially with detox issues, when you get deep massages, often it can be really hard to recover. And I tend to think that it has something to do with that tissue massage causing toxins that are stored in your tissues to be massaged out, if you will, into the bloodstream. And so that can sometimes flare people up. Maybe it has something to do with Lyme being pushed out of the tissues and the immune system seeing it. But I tend to see a lot, especially with deep massage, that people flare up significantly, okay? If you are to do massage, you might want to try doing a non-deep tissue massage first to see how you tolerate it. But I have even seen times where people will flare up with that as well, too, okay? All right. Good luck to you, Colleen. Thank you for that question. Hello, Jackie. Let's see. Good evening. I have been off yeast and sugar for approximately 6 weeks. It definitely helps, but think I need to cleanse. Can I use yeast cleanse, or do you have a specific method? Also, as an ethical vegan, I cannot follow your suggested Lyme diet. Can I replace animal products with healthy, non-processed vegan options? So Jackie, about my call for doing a paleo type diet, if you look at the diet that I put up there, there are, it is more difficult, it is more complicated, I will admit, to be paleo and not have animal products, okay? However, you can do soy as an option. You can also increase your intake of nuts, and as a means of doing it as well too, okay? So those are some things to think about. Take a look at the, if you have not done so, read through the documents that are part of my paleo diet. And you'll see that there are some recommendations you can do if you happen to be somebody that is vegan or vegetarian, okay? So take a look there. About your first part of your question, I'm not sure what you mean by a yeast cleanse, okay? So it may be what you mean is being on a lot of probiotics and not having food with simple sugars, all right? And yeah, I think it's a good idea to, if you have yeast problems, to limit your sources of feeding those with simple sugars. And I think it is a great idea to be on probiotics. If you're looking for my ideas about what the best ways are to kill yeast, I would take a look at the article I showed you earlier about called Kills Yeast, a Brief Guide, okay? All right. Good luck to you. Thank you for that question, Jackie. Let me do a quick screen share here, everyone. I just wanted to show, because I'm not sure if everyone knows about this. Many of you probably do, but so I'm going to go look at the Treat Lyme book. Okay, so in the Treat Lyme book, or many of you are familiar with my Lyme disease treatment guideline, okay, under the treatment protocol tab. And if you look into my treatment protocol, the first step, so these are the basic steps anyone should do when they have Lyme to recover, okay? These steps are all as important as being on antibiotics, all right? And either prescription or herbal antibiotics. So first part, sleep, I give you some recommendations on that. Second part is the diet, okay? And this is what she was talking about. And the diet I recommend is this best brain, inflammation, pain, energy, and detox diet ever. It is a paleo type diet. Take a look through here. There's even some videos that are built into this. That's from when I didn't have much, a no hair phase that I went through there. And there's a bunch of documents that you can look into in here too, of which some of those documents describe what to do if you happen to be more vegan or vegetarian. Okay. All right. So this is what she was referring to. All right. Let me go back here. All right. All right. Hello, Sue. Let's see. Thank you for these terrific webinars and all you do for us. You're welcome. Is Saccharomyces boulardii still safe to take? Our daughter's Lyme literate doctor says it is not. I've also read that if one is on antifungal medicines, nystatin, then Saccharomyces should be avoided. Is this true? So the answer to all that is I disagree with your daughter's Lyme literate doctor. Okay, so Saccharomyces boulardii. Let me tell you what it is first. So Saccharomyces boulardii is a healthy yeast that lives in our intestines. Okay, and it lives there even in healthy people. Now, there is some evidence that taking it, or there's some evidence that says that being on Saccharomyces boulardii can actually treat for a problem that some people get called C. difficile. So C. difficile, many of you may be aware of it, is a bacteria that lives in the intestines also that can grow too much when you're on antibiotics. It's actually a kind of a strange situation that you're on antibiotics, it kills bacteria, and yet this is a bacteria that will overgrow. And if you get C. difficile, it gives you severe watery diarrhea, lots of abdominal cramping, and sometimes can be hard to treat, okay? So I will use Saccharomyces boulardii, especially if I have a patient that ever got C. difficile. When they go back on antibiotics, either herbal or prescriptions, I will have them on Saccharomyces boulardii to prevent getting C. difficile again. And definitely if I have somebody that has gotten C. difficile, as part of their treatment for that for the C. difficile, in addition to using antibiotics that will kill the C. difficile, I'll put them on Saccharomyces boulardii too. Okay. Now the other time I will use Saccharomyces boulardii is if I've got somebody that is on antibiotics and they're having watery stools and they don't have C. difficile. My first step that I'll do when somebody's got watery diarrhea, not due to C. difficile, and they're on probiotics, is to increase their probiotics. Okay, so probiotics are things that have lactobacillus in them and bifidobacterium, or bacteria from the ground. Okay, you can have soil-based probiotics as well too. The bifidobacterium and lactobacillus I was just telling you about are the common bacteria found in most probiotics. And then there are some probiotics which are soil-based probiotics, like Prescript Assist Pro that I write about in the Treat Lyme book. All right. So those are all bacteria. And my first approach when I get somebody with watery loose stools that is not due to C. difficile is to double the probiotics. All right. So if somebody's on 50 billion cultures, I'll have them increase to 100 billion cultures. If they're on 100 billion cultures, I'll have them increase to 200 billion cultures. All right. That's the first step. All right. But if that doesn't work well enough, then I will have them add Saccharomyces boulardii. Okay. So I will use it frequently for those reasons. All right. I usually do not put people on regular Saccharomyces boulardii though, because I don't think it's needed. Okay. Now, the issue with nystatin is an anti-yeast medicine, all right? And Saccharomyces boulardii is a yeast. So if you take them at the same time, it may be wiping out the Saccharomyces boulardii. So if you're going to do the Saccharomyces boulardii, I would say to take it as far away from the nystatin as possible, okay? Just as a precaution, okay? All right. So those are my comments on that. Thank you for the question, Sue. Hello, Deborah. Let's see. Hi, Dr. Ross. I have had elevated MCV and MCH. I am now taking methylated vitamin B12 shots. How long should I take it to see results in the red blood cells? Do I also need methylated folate also being worked up for pernicious anemia? And could it help my neuropathy? Thanks. Okay. So everyone, MCV stands for mean corpuscular volume. Those are some strange words we use in medicine. Basically, it's the size of your red blood cells. How big are they? Okay. And I usually don't use MCHs. I'll just rely on the MCV. They give you comparable information. Okay. But MCV stands for mean corpuscular volume. And if you get large red blood cells, there are two vitamin deficiencies that could lead to it. One is vitamin B12 and the other is folate. So in working up somebody for large red blood cells, you want to check a vitamin B12 level, and you want to check a folate level, all right? And if they are abnormal, you need to correct for them. So I hope, Deborah, that somewhere in here, somebody's just not giving you B12 without also making sure that you have low folate, all right? If you have low folate, you should be on folate as well, all right? Pernicious anemia, everyone, is a condition where the stomach fails to make a protein that is needed to help absorb vitamin B12, all right? And so you need that protein. If you don't have that protein, it's called intrinsic factor, then you're not going to have adequate absorption of B12, all right? Now, Deborah, if you are a person not making intrinsic factor, and it sounds like they may be working you up for that, if you do not have intrinsic factor, one way to get your B12 in is like you're doing, which is the B12 shots. But another way to do it is you can actually do it under your tongue. You can do it as drops and spare yourself from having to do the injections, okay? And so you can get a compounding pharmacy, your physicians can get a compounding pharmacy to mix up the methylated vitamin B12 as in a drop form, and then you could just do it under your tongue. So for instance, when I've got people with this problem, and it can get as well absorbed into the bloodstream under the tongue as it does through the shots, okay? So sometimes I'll have my pharmacist mix up something like 3,000 micrograms of vitamin B12 per drop, and I'll have a person do 1 drop a week, for instance, okay? And then you got to measure your B12 and do your blood counts to see if that's going to be adequate. So my first question to you that you need to make sure of is, did they check folate? And if they didn't, they need to, because it can be part of what this problem is. If you do have a folate deficiency, then yes, by all means, get on folate, okay? If you don't necessarily need to be on it, all right? And yes, if you happen to have pernicious anemia with low B12, correcting for it could help your neuropathy. In my experience, neuropathies can start occurring from low B12 at a level of 500 or less on your blood measurements of that. Keep in mind, most labs report 200 or higher as normal, but I find that neuropathies will respond even if it's 500, between that 200 and 500 that most labs would say is normal. I like to get mine at 500 or higher, okay? All right, so good luck to you with that. All right, let's keep working through these. Let's see here. Hello, Eric. Hold on here, man. I'm just going to take a quick sip of water. Hi, Dr. Ross. Let's see. How well do you think nebulized glutathione works for your patients? Do you prescribe it often? I don't feel the oral really is absorbed well in me, and I've had IV that helps, but too expensive to do it often. Thank you so much. You're welcome, Eric. So everyone, there's 3 ways that I like to give glutathione. One is orally. The other one is nebulized, which means you breathe it in, okay? And the third way is IV, right? The problem with oral glutathione is it may have difficulty being absorbed. Now, there are some manufacturers that make it in a way that it can be better absorbed, and the best way it can get absorbed is if you have something called a liposomal variety. Liposomal means that it's glutathione that has been microscopically wrapped in fat. All right, so for instance, I use a manufacturer called Research Nutritionals, and Research Nutritionals has a product called Trifortify Orange. They now have a new product out, as I understand, that we just got in. I've got to put it up on our store, called Trifortify Watermelon. So this will be pretty good taste, actually. I'm told by those that have tasted it, it's not bad. But any of the Trifortifys by Research Nutritionals are glutathione that is microscopically wrapped in fat to increase its absorption, okay? And of the Research Nutritionals product, I usually have people take 5 milliliters 1 time a day. But in some people, they still may have trouble. So if you're a person that you notice improvements on your IV, but you do the oral and it doesn't seem to work as well, you probably have an absorption problem. So another way to get the glutathione in is to do it nebulized. Nebulized means you have an air compressor. They're usually about that big. that has an air tube that comes out one end, goes up to a container that you dump your glutathione in, has a cap that screws on it, and then the air through the tube blows over the glutathione, turning it into a mist, and you got a mouthpiece you put in your mouth and you breathe the stuff in, okay? So when you breathe medicines into your lungs, the lungs have a lot of blood vessels, all right, and things get easily absorbed into your blood system, all right? So there's two ways to get things in your blood with glutathione. One is give it IV, or breathe it in to get it into your bloodstream, all right? And that can work really well. Eric, I find that for most people, the nebulized works as well as the IV. That's what I find. Now, it's not always, but for most people it does. The dosing I like to use if you're going to do nebulized is, I usually have my pharmacist mix it up as 200 milligrams per milliliter, and then I'll have somebody do nebulizing it as 2 milliliters twice a day, okay? That's usually a pretty good dose. Now, sometimes that 400 milligrams that you get, so 200 milligrams per milliliter times 2 milliliters is 400 milligrams per dose, all right? At 400 milligrams a dose, some people find it to give kind of a burning sensation in the chest, kind of like that sensation like when you go outside and you breathe in really cold air and you kind of get that burning sensation in the chest. You can get that from the concentrated glutathione. And so what you can do if that happens is to dilute it with an additional 2 milliliters, 1 to 2 milliliters of water. Just dilute it to make it so it's not quite as concentrated. And then often that is well tolerated to do it that way, okay? All right, so those are some thoughts. Anyone that wants to do more about glutathione and what we're talking about here, let me just show you something. I'm going to do a screen share again. All right, so glutathione, everyone, is the master detox chemical, or is an antioxidant that is made in every one of our cells, and it's used to repair things. So it's the Mr. Fix-It. It fixes everything, okay? And I have written an article about it. You'll find it actually in the detoxification chapter is one of the places you can find it, but I call it Glutathione, the Great Fixer, okay? So as the master reparative antioxidant, it actually is made in every one of our tissues and it fixes damage. And so, for instance, if you have neuropathy, you may have basically burnt out, exhausted your glutathione supply. So sometimes it helps to give more. The other thing that glutathione does is it's involved in liver detoxification. And I also sometimes will use it in people. I will use it as part of my protocol to help with Herxheimer reactions, because the other thing is a great antioxidant, and as an antioxidant lowers oxidizing agents that tell your white blood cells to make cytokines, all right? So in a Herxheimer, you got a lot of cytokine excess, all right? So glutathione helps with detox. It's what the liver uses to pull toxins out. It helps limit Herxheimer reactions. It can help with nerve repair, or if you're starting to get liver inflammation on your antibiotics, it can help with liver support as well too, okay? And it helps with people with cognitive issues as well too. So I like it. I like to use it in various situations, all right? Read that article. You'll see more about the various ways you can administer it, and also more about the science behind glutathione as well too. All right. Thanks, Eric. Good luck to you. All right. So I just want to show everyone something here. Let me go back. I'm going to do another screen share here. Okay, so I'm going to go back over here. All right, so this is the Treat Lyme book. This is what I want to show you, though. Okay, so I get asked frequently, what products should I use for my supplements? So as you know, in the Treat Lyme book, I often talk about supplements in terms of their generic name. I don't give brand names usually, all right? And that is because the Food and Drug Administration basically says I can't. So I give you generics. But if you're looking for products that I recommend that I use with my existing patients, and these are ones that I basically have gone out and figured out what looks like the companies are that have the greatest chance of using the best active ingredients, and also are companies that tend not to put a lot of garbage fillers in that could hurt you. If you're looking at what those products are, take a look at my my supplement store. It's called Marty Ross MD Supplements. You'll find it at treatlyme.com. So if you're looking at what do I have for glutathione, you just go up to the search box here, type in glutathione, and there you'll see it's the Tri-Fortify Orange, okay? Hopefully in the next day or two, I will also put up the Tri-Fortify Watermelon. That's out now too. All right. The other way to find products here is either look by medical problem or look by manufacturer. So for instance, we're now carrying all of the Research Nutritionals products. I know many of your Lyme docs work with Research Nutritionals. I carry those all online too. All right. So that's where you would look for them. All right. Let me go back here. All right. There you go. Okay. So let's go on here. Hello, Val. Let's see. Hi, Dr. Ross. Our 10-month-old grandson is diagnosed of infantile nephrotic syndrome. Symptoms are hypoalbuminemia, hyperproteinemia, and swelling. A possible cause is infection, including syphilis, leptospirosis, and viruses. Living in Lyme endemic Connecticut, could this be related to Lyme and co-infections? Wow. First of all, I'm sorry to hear that about your son. So everyone, nephrotic syndrome is a problem of the kidneys, basically, where the filtering device called the nephron and the kidneys don't work correctly. And as a result, adults as well as kids pee out too much protein. When you start losing a lot of protein, that makes it harder to hold water in the body, so people swell up. All right. I'm sorry. It makes it harder. So proteins hold water in tissues. If you're peeing out a lot of proteins, proteins hold water in the blood vessels. And if you don't have enough albumin, which is one protein in your blood vessels, or other proteins in your blood vessels, water will not be held there, and it goes out into the tissues, causing swelling of those tissues. Okay. All right. So, Val, I am just not aware. I have not seen any science that says Lyme or co-infections cause nephrotic syndrome. I'm just not aware of it, nor have I seen that in my practice where I've been treating Lyme disease since 2004. I have never run into a situation like that. So my answer would be no. I'm wondering, Dr. Jones, many of you know him, is a pediatrician out in Connecticut that has fought the good fight trying to keep his license to treat Lyme, and has also extensive experience treating pediatric Lyme. You might want to contact Dr. Jones's office to see if they have any experience. I'm just not aware of it. Okay. All right. All right. Good luck to you, Val. Hello, Eric. Let's see. My liver enzymes are getting higher as I treat. AST 25, ALT 46. Should I be concerned about ALT? Anything I can do to get them down? My fasting glucose also went up to 109. All right. So the liver enzymes AST and ALT are made by liver cells, okay? And if the liver gets inflamed, those can become elevated. Now, I expect when I treat Lyme that on certain medications, there will be some inflammation of the liver. My goal with those elevations is to try to keep them within 2 times the upper end of normal. So for instance, your ALT of 46, this lab's normal range is 9 to 46. So 2 times the upper end of normal means 2 times that 46, which is the upper end of normal, which would be 92, okay? So I would try to keep your ALT so it's 92 or less, all right? That's what I would do. So should you be concerned about that 46? Probably not. The reason you get concerned is if you have ongoing significant, way big elevation of your liver enzymes at 2 times above the top end of normal, there is a risk of developing a chronic or that kind of inflammation can lead to scarring down the road, scarring of your liver, okay? But I don't see it to be a problem at 2 times or less the upper end of normal. If I do have somebody that is starting to develop elevated, the numbers that go above 2 times the upper end of normal on medicines, I will do things to support the liver or change the medicines they're on. The thing I'd like to do in this situation that would support the liver is actually to get on glutathione, all right? So 400 to 500 milligrams 1 time a day. Again, as I was pointing out earlier when I was talking about glutathione, glutathione is the master detox chemical of the liver. It also fixes things, okay? So it fixes injury, it fixes inflammation of the liver cells, all right? So I usually would get on glutathione as well too, okay? But at the level you're at, I don't think you have anything to worry about here, Eric. All right, good luck to you. Thank you for that question. Hello, Suzanne. Thank you for the hello, I appreciate that. Hello, Laura. Let's see. What is the best Babesia treatment that you recommend? I'm about to start Mepron, azithromycin, and artemisinin. So, Laura, I've written a whole article about this, and there are many different treatment options. I break my Babesia treatments into 3 categories in terms of how well they work. The combination of Mepron and azithromycin is one of the things you can do that I call a tier 1 treatment. Tier 1 treatments are things that work about 80 to 85% of the time. Artemisinin, I will also use by itself sometimes, and I call that a tier 3 treatment, which works about 70 to 75% of the time. I don't think, unless you've had trouble treating your Babesia already, that you necessarily need to do Mepron, azithromycin, and artemisinin. That Mepron coupled with azithromycin is a good treatment on its own. And keep in mind, artemisinin is a toxin. I don't think you need to overtox yourself here, basically. I would start probably just with your Mepron, azithromycin, and if you're having difficulty with that outworking, then you might want to consider adding an artemisinin to that or changing exclusively to artemisinin, all right? So let me show you an article. I'll do a screen share here just so you can find this later. All right, so I'm going back to the Treat Lyme book, all right? Take a look at, in the chapters, my infection treatment plans. There is the article called Kills Babesia, a brief guide. All right, and keep in mind, you got to do things to boost the immune system. I talk about that right here. But then there you go. Tier 1 treatments involve atovaquone, okay? And anyhow, that's one, or atovaquone by itself, which is your Mepron, all right? And I'll take Mepron, I combine it either with Zithromax, Biaxin, Doxy, or Minnow. Those are usually some things I'll look at. But in this article, you'll see there's tier 2 treatments, and there are tier 3 treatments as well too, all right? So that's called Kills Babesia, a brief guide. Take a look at that later, okay? All right, so many of you, just so you know, and many of you may be new to these forums, just about anything that I talk about here in these webinars, there's probably an article I wrote about it in the Treat Lyme book. And as many of you know, there's no way I'm going to get to all the questions that have been posted here tonight. There's a lot. So if I don't get to your questions, take a look at the Treat Lyme book. Look in that chapters tab. See if there's a chapter where you think there may be something I wrote, okay? Or use the search function. There's a search function there where you can write down Babesia treatments, and it will pull up the articles that I've written about it, okay? Yes, you have to subscribe, and yes, you'll have to pay for it, but it's less than the cost of a coffee, all right? And if you look at the breakdown of the price, and what you're doing is you're supporting my ability to maintain that site, and also to keep putting out new articles and updating the existing content, all right? So take a look there if it's things that come up definitely between the webinars, or if I just can't get to it here in the webinar, all right? All right. All right, so let's see here. Let me go back here. All right, hello, Suzanne. Let's see. After starting rifampin, how long should you take it before introducing minocycline? You can take them both at the same time. You could start them both right away if you want to. Or if you're wanting to make sure you're not having a severe Herx reaction, maybe a week or two, and then go ahead and start it. But I often have people start them both at the same time, Suzanne. Okay? All right. Good luck to you. Thank you for that question. Hello, Sue. Let's see. Can Banderol and Cemento cause itchy eyes, chest congestion, and dry cough like an allergy? You know, anything can cause an allergy, all right? So I haven't seen this as a side effect, and I use a lot of Banderol Cemento in my practice, all right? For those of you that are not familiar with Banderol Cemento, they are my two favorite herbs to use to treat Lyme and kill Lyme. They're herbal antibiotics. They are called, Banderol is Otoba bark extract. Cemento is cat's claw. They work as well, in my opinion, as prescription antibiotics. They have about an 85 to 90% chance of helping a person, okay? So I use a lot of this in my practice. But I haven't seen a reaction like this before. But, you know, anything can happen to anyone with anything. What I'd suggest you do to see if they're coming from Banderol Cemento is stop them. And if the symptoms get better after about 2 or 3 weeks, then reintroduce them again, one at a time, and see if you do have any problems with allergy or those kind of symptoms developing from it, okay? All right. Good luck to you. All right, let's see here. Hello, Lisa. I see that you sent sent a second message already, so I can interpret what that asterisk is. All right. So everyone, what Lisa says is there's an 8-year-old treated for Bartonella and Babesia with clarithromycin, rifampin, Japanese knotweed, Artemisia, Sida acuta, and Cryptolepis. All were stopped when ALT increased to 42. Yeast infection, eye infection, nausea, stomachache. Now just on ABART and ABAB, but not effective. What else can be taken? So first of all, I wouldn't have stopped them because of that ALT of 42. All right. As I said, I will run my ALTs up to 2 times normal. So I'm not sure if those were working, then I probably would continue them. All right. However, just to be critical, I'm going to be critical. So the clarithromycin, rifampin would treat your Bartonella, and also that combination would treat Lyme. The Artemisia, and actually Sida acuta could treat Lyme too. The Artemisia, Cryptolepis, and Sida acuta would treat Babesia. It's not clear to me you need to be on all 3 of those to actually treat Babesia. The artemisinin by itself or the Cryptolepis by itself may be enough to treat Babesia, okay? So if you are looking for ways to decrease that ALT, to put less toxins in that may still do as well, go back to the clarithromycin, rifampin, but choose either Artemisia or Cryptolepis for the Babesia, if you have Babesia, if your son, the 8-year-old has Babesia, okay? I do not find Byron White formulas to be that effective. That's your ABART and your ABAB. I've used them. I just don't see it. I don't understand why a lot of my colleagues even use them. I just do not find those formulas to be effective. I don't use them in my practice with any regularity. Occasionally, I will use an ABART when nothing else is working, but I just find them as a whole not to be that effective. So that doesn't surprise me, okay? Yeah, you know, in terms of yeast infection, eye infection, nausea, stomach ache, as reasons you stop these other things, you know, some of that may be side effect. Sometimes there's other things you can do for yeast. To be honest with you, to figure out what to do about those, I probably need to talk with you a little bit more to figure out where to go. Those kind of questions would probably be better if I actually did a one-to-one consult with you, okay? So those are just some of my thoughts on that. All right. So I think I showed you how to do the one-to-one consult earlier tonight. There's a tab on the Treat Lyme book page that you can click on that will allow you to start reading about how can you have an online visit with me, and I can give you some input that way too. There's a lot of questions I would need to ask more about eye infection, nausea, and stomach ache. I'm not sure what you exactly meant by those. I need more information about that. All right? Okay. Good luck to you, Lisa. All right. Hello, Sheila. Have any of your patients tried or used CBD oil for pain, sleep, anxiety? Do you have brands that are quality that you recommend? So, Sheila, I live in Washington State, in the United States. I'm not sure. The reason I say the United States, everyone, is I have a number of people that attend these webinars from the United Kingdom, where it's very early in the morning right now, and also from Australia. Okay. So I can't tell where you're from, but here in the United States, there are a number of states that have medicinal marijuana laws, and we happen to be one. And so in Washington State, I can have people get high quality CBD by going to their marijuana dispensary. So I don't worry about quality. Now, CBD that we have here in Washington State from a marijuana dispensary comes from the marijuana plant. If you are getting CBD through Amazon or through other retailers that are shipping interstate, those are not coming from marijuana, because marijuana is banned by the US federal government. And you cannot do interstate transport of a banned substance, all right? So these medicinal marijuana laws only apply to the state that you're in, all right? So, and just a word about that then. So then CBD that you're getting through Amazon or other retailers that ship is probably coming from hemp, not from marijuana. And the quality of those products can be difficult at times. I'm not familiar with what would be the best way to go with that. The problem is the concentration of CBD in hemp is not as high. There can be various strength issues of it coming from hemp where it's not as good as the quality you actually get from marijuana. So I'm not sure what a good CBD from hemp that you buy on Amazon or get online and have shipped to you cross state lines would be, okay? Because I benefit here in the state of Washington of being able to do CBD through marijuana products, and it has good quality when you get it that way. Yeah, in terms of CBD in general, though, I think it's great for symptoms that people have with Lyme. The only thing it probably isn't going to help with is your thinking, as it may cloud your thinking. CBD, everyone, is an oil that comes from marijuana or hemp. And the marijuana plant, it comes from the green parts of the plant, so the stems or the leaves, and is low in CBD oils are rich in CBD, cannabinoid oil, and they're low in THC. THC is what gets you high when you smoke marijuana. And when you use marijuana recreationally, that's coming from the bud of the plant, the flower part of the plant, okay? And that is what gets you high. Generally, CBD, people don't get high on it because it's low in the THC part, okay? So you don't have to worry about getting high on it. Now, there's a colleague of mine, Ernie Murakami, who's a medical doctor that many of my Canadian patients, many of you are from Canada, know about Ernie. Ernie is a physician up in British Columbia that they used some trumped up charges for medical record issues where they were able to get him to stop treating Lyme disease. He no longer treats, all right? So they basically went after him for treating Lyme disease. But Ernie has been promoting the idea of medicinal marijuana and actually looking into it. And I think he's responsible for either conducting or being involved in the conduct of some petri dish experiments looking at CBD oil. And he's been able to show with those petri dish experiments that you can get some good killing of Lyme too. My sense of CBD as an agent to kill Lyme is that it doesn't work that well, actually. Okay, unfortunately. All right. So anyhow, that's what I've got for you. But it does do a good job in terms of taking care of symptoms. All right. All right. Good luck to you. Thank you for that question too, Sheila. Hello, Sarah. Let's see. I have been taking glucosamine sulfate 500 milligrams 3 times a day for a month, along with curcumin for pain. This is for damaged cartilage in my knees and hips. How long might this regimen take to begin replacing cartilage and alleviating pain? Thanks for your help. So everyone, glucosamine sulfate is a chemical building block for cartilage, all right? I also will use it in people that have bladder irritation from something called interstitial cystitis, which is inflammation of the lining of the bladder that sometimes occurs in Lyme and in Bartonella. That's because in the bladder, it's turned into kind of a microscopic gelatinous coat that coats the lining of the bladder, protecting it from urine so that it doesn't cause bladder pain, all right? That acidic level of urine doesn't cause bladder pain, all right? But in this situation, you're using it to build cartilage, and it can work quite well. Make sure you're using a good quality product. I prefer Thorn. There's a lot of garbage glucosamine out there, right? So if you're going to do step one, if you're going to use glucosamine to see if it can help with knee pain from cartilage being destroyed or being broken down, you want to make sure you're using good quality. The product I like is a Thorn product. I trust the ingredients that are in it. And the other thing is some of the lower cost products that are out there are one time a day products. Do not do a one time a day product. They just don't work well. Even if it's 1,500 milligrams one time a day, that does not work well. Do a 500 milligram 3 time a day product. My preference is Thorn, okay? All right. It can take to rebuild cartilage in your joints. If glucosamine is going to work, it takes 2 to 3 months. That's been what my experience is. I find it helpful about 70, 80% of the time. I see that it can make differences, okay? Now in Lyme, many people do get a breakdown of cartilage in the joints. So some people in Lyme, your joint pain is all due to inflammation from the germ being there, okay? If you're treating Lyme and a lot of your symptoms are getting better, but your knee pain and your joint pains isn't getting better, it could be that what's happened is Lyme has released enzymes that have broken down some of your cartilage. And so it's in those kind of situations that I think about trying a trial of glucosamine. And I'll use it for 2 to 3 months. That's usually what I tell people to use it to see if it's going to work. If absolutely by 3 months you're not getting any changes, it's not going to work. You're going to be in that group of small percentage of people. Well, actually 20 to 30% of people where it may not have benefit. Okay. All right. Good luck to you, Sarah. And thank you for that question. All right. Let's see here. Hello, Sandra. Thanks for your time. Dr. Ross, you're welcome. I have a quick question. Well, let me see, Sandra, if I can find the rest of that question. Hold on here a minute. Huh. Sandra, I am not finding the rest of your question there, so I apologize for that. All right. Hello, Lisa. Let's see, 8-year-old having headache, not sure if related to Bartonella, Lyme, or Babesia, or the common cold. No relief from ibuprofen. Any suggestions? If it is not related to Lyme, try Tylenol, okay? A common thing you can give a try. You probably have already done that. If that doesn't work and it's due to Lyme or the co-infections, that could mean it's a headache from cytokine excess. And the thing that works to lower cytokines is not ibuprofen and is not Tylenol, all right? What can work is curcumin. And many of you know I talk about curcumin often. It's a component of the Indian seasoning turmeric. In an adult, you would do 500 milligrams to 1,000 milligrams 3 times a day. And your 8-year-old, I would try it at 250 to 500 milligrams 3 times a day. It's curcumin. It's a derivative, or it's a component found in turmeric, the Indian seasoning turmeric, and it gets inside white blood cells and limits cytokine production. Okay, so that might be something that you give a try. Good luck to your 8-year-old. All right. Hello, Christina. See, I would love to know your thoughts on Candida overgrowth. I have Lyme, babesiosis, and Candida. I have only eaten meat and non-starchy veggies for a year, 2 Candida cleanses, one of which involved 5 weeks straight on diflucan. Candida levels through blood work barely went down. All right. So, first of all, blood work and Candida, I don't believe in doing blood testing for Candida, and here's why. So when your doctors are ordering blood work, what they're measuring are antibody levels, and they're probably measuring a type of antibody called IgG antibodies, all right? And so IgG antibodies are going to go, once you make them, you will always make them. And the reason you may be making them is just because you have yeast living in your intestines. We all have yeast living in our intestines, all right? So even in healthy intestines, there's a balance between bacteria and yeast. And so in some people, their immune system will see those yeast that are naturally living there and make antibodies. So I don't think it's accurate to follow antibody levels to find out what's happening with yeast, all right? So that's point number one. But if you are having symptoms still suggesting a lot of yeast, then you might want to try a different way of treating besides doing diflucan, all right? And so what I'm going to do, Christine, I'm going to have you take a look at the article I've written on this. And the reason I'm going to do that is we're starting to run later here. And I lay out different options and ways you can figure out if you have yeast, and what do you do if diflucan doesn't work? What's the next step? What are other alternatives you can do, okay? So since I've written a whole article about this, I'm going to show you where you can read it. And let's see here. There we are. All right, so I'm in the Treat Lyme book again. Go to the chapter called Yeast. All right, and take a look at this article called Yeast, a Brief Guide, okay? And if you're wondering, ignore those blood tests. If you're also looking for ways you can figure out if you have too many yeast still, take a look at my article called A Silent Problem, Do You Have Yeast, okay? These are both very thorough articles, and they'll give you the information you need, okay? All right, let me go back here. All right. Good luck to you, Christina. Hello, Jacqueline. Let's see. I am currently being treated for Lyme, Babesia, and Mycoplasma pneumoniae chronic. I have been sick for years. All right. So I think, Jacqueline, you gave me a question earlier. Okay, yeah, that's right. You asked earlier about which bacteria might be causing that, and this is more about the medicine. So let's see. I have also trigeminal bilateral and take 1,300 milligrams of carbamazepine daily. Do you know much about trigeminal neuralgia, and have you suggestions for meds to help pain? So Jacqueline, earlier what I suggested to you is to repair the nerve injury, okay? So ultimately, to get your nerves to stop hurting, you should repair it. And I showed you an article that you can take a look at on nerve repair, but quickly, there's a few things you want to do. Number one, you want to repair the cell membrane, fat membrane that makes up your nerve. Excuse me. And to do that, you want to use a product called NT Factor made by Research Nutritionals. It's composed of the fats that make up the nerve cell membrane. It also is composed, those same fats are the same fats that make up the energy factories in every one of our cells called mitochondria. When you get injured nerves, you also probably have injury to the nerve cell mitochondria, which makes it hard for the nerves to generate energy to heal. So the thing you do to repair the nerve cell membrane will repair the mitochondria membrane. Start with NT Factor 2 pills 3 times a day for 2 months. And if you are getting some benefit, then continue that at 1 pill 3 times a day for 4 more months, okay? Second thing, get on glutathione. And I prefer oral, but if you can't tolerate that or it doesn't seem to be working well enough, then try the nebulized glutathione I talked about earlier tonight, or IV glutathione. The oral form of glutathione I like is the Trifortify Orange, also by Research Nutritionals, and I would do 5 milliliters 2 times a day in this kind of a situation, okay? Third thing I would do is if you are not treating Babesia at this time with either Mepron or Malarone, then I would also get on something called coenzyme Q10, which you can't use with those medicines, okay? But you can use it if you're not on Mepron or on Malarone. You can use CoQ10, 400 milligrams twice a day. That also helps your nerves function better and the mitochondria function better too, all right? So those are some things I would do for nerve repair, all right? Now, other medicines for nerve pain, just to manage the pain while you're trying to heal the nerves. Any of the anti-seizure medicines, you probably have tried these, like Lyrica, gabapentin can help. Sometimes you can use anti-depression medicines like nortriptyline, protriptyline, desipramine, imipramine, amitriptyline. Those sometimes can help as well too. And there's another anti-seizure medicine called Gabatril. Those would be the things that I would be familiar with that can sometimes make a difference here, okay? But the big thing I would suggest is fix those nerves, repair them, okay? In addition to treating the infections like I talked about earlier, make sure you're doing the things to repair the nerves, okay? All right. Good luck to you, Jacqueline. Hello, Randy. Let's see. I'm taking Banderol Cemento for Lyme and Babesia. I got Cryptolepis today. How much of it do I take with the Banderol Cemento? Should I take artemisinin also, and how much? Thank you for your kindness. Randy, you're welcome, by the way. Thank you for that. The way I use Cryptolepis is I have people take 5 milliliters of it 3 times a day. All right. So everyone, Cryptolepis is an herb that comes to us originally out of Ghana, Africa, and where it was used successfully to treat malaria. And probably about 4 or 5, maybe 3 or 4 years, it all blurs together, but 3 or 4 years ago, I think, we started using it to focus on Babesia treatment as well. And seems to do a pretty good job. I give it about a 75-ish% chance it will work. It is some foul tasting stuff. I just want to let you know it's bad tasting. Some people can't stomach it, all right? But 5 milliliters 3 times a day. Now, I would start with it by itself, Randy. And after about a month or so, if you're not getting some improvements in your Babesia, well, a month to 2 months, if you're not seeing some improvements, not that they're gone, but improvements in your Babesia symptoms, then you might want to look about adding in the artemisinin, which also works about 75 to 80% of the time, okay? And if you're looking at how I use artemisinin, take a look at the article I've written, everyone, called Kills Babesia, Brief Guide to describe the way that I use artemisinin, which is a way of doing it 3 days on, 11 days off, okay? All right. All right. Good luck to you, Randy. Let's see here. Hello, Yona. Let's see. How long does it take to heal leaky gut? So leaky gut, I find, if you've got yeast, often when people have leaky gut, it's being triggered by having yeast or parasite infections of the intestines. So everyone, what leaky gut syndrome is, just to make sure we're all on the same page, you got the inside of the intestines, then you have a layer of cells that touch each other really tight, right? This is a cell, this is a cell. Layer of cells touching each other very tight. Intestines, inside, this is where your poop is. Cells, then you've got a bunch of immune cells. Then down here, you got a blood vessel, all right? All right, so in healthy intestines, the stuff up here in your intestines cannot get into these immune cells or your blood vessels down here because these cells touch tight, block them, keep them from getting through, okay? When you've got leaky gut syndrome, what happens is yeast growing on these cells or parasites growing on these cells cause these cells to plump up and pull apart, and you develop gaps, all right? Now what happens is you start getting partially digested food and toxins leaking through here when they're not supposed to, right? Because what's supposed to happen when this is healthy, good bacteria up here and enzymes break food into very, very, very small particles that get absorbed to the inside of these cells. They get passed through these cells. They go through all these immune cells down here, and then they get into the bloodstream. Okay, that's in a healthy intestines. But when you got leaky gut, through these gaps, things leak through that are only partially digested, or toxins get through. Guess what they hit? All these immune cells down here, okay? Your gut lining, 60 to 70% of your immune system is the gut lining, all right? So now you've got stuff hitting those immune cells that's not supposed to. You get big pieces of gluten instead of very, very small amino acids from gluten. And you get big pieces of fat. And suddenly the immune system starts recognizing things like corn and wheat and dairy and honey, whatever it is, as being something to react to because it's seeing big pieces instead of small pieces, all right? And what the immune cells do there is they release cytokines and they release histamines, all right? So to heal that, you got to get rid of the yeast and you got to get rid of the parasites if they're there, all right? That's one thing, first part. Second thing, that usually will be enough to take care of it. And then you also want to rebuild the good bacteria there too. So you got to get on a lot of probiotics, okay? And then sometimes, if that's not enough, I'll have people take vitamin A, 10,000 international units a day, and vitamin D, 5,000 international units a day. Those help build up the mucous membrane layer of the intestines. And then I also will help repair the cells by having people take something called glutamine powder. And I'll have a person take a scoop of that, about 12 grams a day, which is one scoop usually of depending on the product, about one scoop 3 or 4 times a day of glutamine powder. Glutamine is the fuel source for your cells that line your intestines to heal, okay? All right, so my way that I deal with leaky gut, first approach is get yeast and parasites out if they're there, be on probiotics. If by 2 to 3 months somebody still looks like they're having a lot of GI dysfunction suggesting leaky gut, then I start to rebuild the mucus lining of the intestines with vitamin A and vitamin D, and I have people get on L-glutamine powder as well too, okay? How long does it take? Usually about 4 to 6 months, all right? So, Yana, I know that was a long response to your question, but I wanted to make sure everyone else that's not familiar with leaky gut had that as background information too. Usually about 4 to 6 months, okay? Now keep in mind, with leaky gut, you've got all these inflammation chemicals that are being pumped out by your immune cells that line the intestines. And those cells make cytokines, all right? Cytokines are what make you feel bad when you have Lyme. So in some people, the reason they feel bad like Lyme is actually it's their leaky gut producing too many cytokines. And it's not Lyme causing their problems, all right? So I'll just throw that out as a piece of information too. All right. Thanks for that question, Yana. All right. Hello, Jill. Yay! Can hear you. Jill, you must have been one of the people that couldn't, was here last week when I couldn't get my microphone to work. Anyhow, you're welcome. Let's see. Thank you for all you do. My Lyme support group benefits from your webinars when I am able to attend. Okay, my question is, on ketogenic diets in general, and keto OS supplement in particular, does being in ketosis really help starve Lyme spirochetes? I don't subscribe to that thinking. So there are some people that say that because Lyme needs sugar to survive, we should starve it. And because Lyme needs magnesium to survive, we should starve it. And because Lyme needs whatever the thing of the month is that people come up with to survive, we should starve it, okay? Now the problem is, all those things that we think we should starve Lyme of, we're starving ourselves of. That makes no sense. Of course, Lyme is going to live on the same things we do because Lyme lives in us. And Lyme is designed to survive in us, all right? So it's going to use the same things we do. And so I'm not one of these people that believes that you've got to get super strict about starving your Lyme germ because I think it has bad repercussions in us, okay? All right, so that's what I would say to that, Jill, all right? So thank you for that question, and thank you for your comments here as well, too. I appreciate that. All right. Let's see, where are we time-wise here? All right, let's see. We're running out of time here. I'm going to just grab maybe 1 or 2 more questions here. Let's see. Hi, Christina. Does doxycycline treat babesiosis? By itself, it can help. but it needs to be combined with a true anti-malarial medicine. All right. So doxycycline, many of you may know, is an old way that we could treat malaria. So it can kill. And what we treat Babesia with are anti-malarial agents. Okay. So anything we use for malaria should also work for Babesia. However, doxycycline by itself is not going to work as a sole agent. You're going to usually want to combine it either with a coartem or a malarone or a mepron or even a larium, for instance. I might do it that way. Okay. All right. Thank you for that question, Christina. All right, and then I'm going to take one more question here, I think. Hello, Jan. Let's see. Hi, Marty, and thanks for really being here tonight. You're welcome. Jan is using Cryptolepis and would like to know the dosage, time to take, and whether pulsing works well. Jan is very susceptible to medication, so goes light. Help. All right, so Cryptolepis, everyone, is a product made by Research Nutritionals that has in it Cryptolepis and some other herbs that can treat Babesia. Okay. What I find when I use it is I like to have people take it as 2 teaspoons twice a day as a really good dose. But if Jan is actually really sensitive to medicines, you might want to start out at 5 milliliters twice a day. Okay. Now, when we treat Babesia and we treat Bartonella, you should not pulse those antibiotics, okay? So pulsing, everyone, means starting and stopping antibiotics on a regular basis. The problem with pulsing for Bartonella and Babesia is both those germs replicate quickly. So for instance, Bartonella replicates every 24 hours, all right? So if you stop an antibiotic that you're using to kill Bartonella or Babesia and they replicate every 24 hours, guess what happens in the time that you're off those antibiotics? Well, the germs come back, all right? So I don't pulse when I'm building a treatment for a Bartonella or a Babesia, okay? All right. So everyone, that's it for me for tonight. I thank you for being here, and everyone that did show up tonight after 2 canceled webinars in a row. I'm very happy for you to see that you're here. I am having another one next week. I did open up and schedule another webinar next week because of having had the technical difficulties the last 2 weeks. I got to tell you, I'm breathing a big sigh of relief that I was able to pull this off tonight and we're able to get everything worked out here eventually. I was really keeping my fingers crossed tonight, so I'm glad that it did work out. And for all those, again, that sent their well wishes, thank you so much. I do appreciate the support that I get from this community. In a second here, everyone, I'm going to take you over to the treatlyme.net site. You're going to be redirected there from here. If you are interested in subscribing to the Treat Lyme book, please do. And you can do that by clicking on any article you want to read, and you will be asked to subscribe, okay? Keep in mind, when you pay for the articles in the Treat Lyme book, you're supporting the efforts that I do here in these webinars, and also you're supporting my efforts to write articles that can be helpful to you and to others as well, too, okay? All right, and tomorrow morning, you will all get an email from me, probably again around 6:30-ish Seattle time. And with that, we'll have the link to the recording of tonight's webinar. Thanks for being here, everyone, and good night, and good luck with your Lyme disease as well, too. All right, bye-bye, everyone.